Hello and welcome back to Enhanced Wellness Living's Hormone Health Summit. Today we are focusing on pregnancy and our hormone shifts around that phase of life. I'm Chelsea, your functional medicine health coach, and I'd like to welcome our host, Kelly Engelmann. She is our functional medicine nurse practitioner and founder of Enhanced Wellness Living.
Thank you so much, Chelsea. And I want to give a big shout out to Chelsea and Abby for all of the support and really all the team of Enhanced Wellness Living. It takes a lot to do this Health Hormone Summit, and they've put a lot of work into the experience that you guys get to have with this summit. So I'm super excited to have them on the team, and all of their efforts are just beautiful. So today we get to talk about pregnancy and hormone shifts as it relates to pregnancy. And I have to say that the female body is truly amazing and resilient. Just think about all the things that the female body goes through throughout our lifespan, all the hormone shifting and what that entails for our bodies to endure, right? So we think about hormones in the way of mood and energy and sleep and even how we age. But obviously, it affects fertility as well. And I just want to highlight that, we peak hormonally at age 30. And the trends we're seeing today, people are delaying their fertility quest sometimes to beyond 30. So if we're having hormonal challenges with pregnancy, I just want to give you a little bit of enlightenment on why that might be, things that you can be doing. We do have a full talk on preconception, so I'm not going to get into that as deep today as I did before. So regardless if you're currently pregnant, if you're wanting to be pregnant, if you have ever been pregnant, I think today's topic is relevant because what we really want to do is help you connect the dots of all the different things that your body will go through or has been through or will experience in the future. How do we connect those dots in a way that help you make really good decisions about your health, how to keep you really strong and resilient through all the different life changes that you'll have? When I think about, puberty time and we're having cycles irregularly, and then we go into our cycles kind of regulate out and we have cycles each month. Each of those months is kind of a hormonal adventure in the beginning. Typically, things do settle out. Our body finds some rhythm in that hormone balance, but oftentimes we pour birth control pills or other hormonal therapies on top, which may confuse our bodies in the way of hormone balance. And then as we go through our decades, as we go through childbearing years and then on to perimenopause, I see that time from childbearing to perimenopause get really, really short because if we delay when we get pregnant, oftentimes by the time we have our babies, we're already into that perimenopausal phase of life. And that can be kind of a rude awakening, right? And then we go into menopause. So again, I think the more you understand about where you currently are in your hormone journey, how these hormones are impacting you on a daily life, but then also the trajectory of your life, and then what we can do to harness hormone balance. So as we think about making these transitions, when I look, I have the advantage, I've got 30 years of experience in the women's health space and looking and hearing from women just like you of all the different challenges they go through. And when I step back and I really look at windows of opportunity for women to really impact their health in a very powerful way, and when I look at the undercurrent of what I'm seeing, and as we make hormonal shifting, whether that's again puberty and then childbirth and then perimenopause and menopause, each time we go through a transition like that, there's a window of opportunity also for disease states to set in. So if there's an undercurrent of inflammation, which we'll talk about later, and we have a hormonal shift that allows some vulnerability to be there, then oftentimes we can get the diagnosis of things like high blood pressure, things like diabetes, things like autoimmune conditions. And we're seeing it happen earlier and earlier. I used to treat women in their 50s and 60s, kind of postmenopausal with autoimmune conditions. And then, about 10 to 15 years ago, I started seeing their daughters show up in their 30s. And now I'm seeing the granddaughters show up in their teens. So I think what we have to respect from that is any shifting in hormones in a big way, coupled with genetics predisposition and environmental influence, then that window is open. And so we want to close that window as best we can. We want to create some awareness around what we can be doing to protect our bodies in a way that these hormone shifts are just an adventure. They're not a devastation to our overall health and picture. So as I mentioned, the phases of life, premenopausal, anything up until that perimenopausal time frame, postmenopausal, so that's what happens after you've been 1 year without a cycle. We call that 1 day menopause, and then the very next day you're postmenopausal. So again, thinking about you're going to go through all of these phases, hopefully in your lifetime, and thinking about all the different things you could be doing and ways to protect yourself. So when we think about pregnancy specifically, there are phases of your pregnancy. We call them trimesters. So in the first trimester, we start seeing hormones like HCG, which is our pregnancy hormone. It's the hormone that we use to test when we're looking at our pregnancy test. Something that you could do at home in the comfort of your own home to find out if you're pregnant or not today. And so we look at HCG, but HCG kind of sets the stage for what happens with estrogen and progesterone. So that first trimester, oftentimes we may not feel as good as we've had before. Sometimes we have nausea, we have reflux, we have some vomiting occasionally. We may have low energy levels that first trimester of pregnancy, and that's your body kind of ramping up some hormones. Your body's trying to get used to what it's doing, and it's using a lot of energy to grow that human. Okay. Then the second trimester, we move into progesterone is trickling up, estrogen is going up, and typically second trimester, and again, I'm being very general here because this is not one size fits all pregnancy conversation, but in general, second trimester is better. We have more energy, we feel more vibrant, sometimes more creative during that time, and hormones tend to be a little bit more stable during second trimester. And then we enter third trimester where progesterone is going up, estrogen peaks toward the end of that. Relaxin, which is a hormone that starts production even in the first trimester, but it continues to go up into the third trimester. And relaxin is that hormone that helps relax the pelvic floor. It's really important for being able to birth that baby, that we have some laxicity in our ligaments and things like that. But it also makes us a little bit more vulnerable to injury. So we say during pregnancy, we can keep doing the things we've been doing, but maybe third trimester, slow down intensity of those things so that we don't create injury to ligaments and things like that. And quite honestly, most people aren't as comfortable during the third trimester to want to be doing the more high intensity workouts. And then we deliver that baby and these hormones go down. And we'll talk about kind of the impact of that on the body, specifically to the pelvic floor, right? So the pelvic floor is really important. And oftentimes get the question or get a strange look on people's faces when we start talking about the pelvic floor. They're like, what are you even talking about? So the pelvic floor is like a bowl full of muscles. And I actually do a full podcast that I'm going to make sure that we reference on here so that you have easy access to that. But that podcast is with a physical therapist that works on pelvic floor. She's phenomenal, Jody Joyner. She did a really good job of kind of describing what that pelvic floor is all about. But the pelvic floor makes up more than just your vaginal area, right? It's involving the colon and the uterus and the bladder, the urethra. All of that is supported by a bowl full of muscles. And those muscles have a really, really big job. We want those muscles to be able to accommodate what the body needs to endure, whether that's sexual activity, whether that's having a bowel movement, or whether that's birthing a baby. And so that pelvic floor needs to be able to expand and it needs to be able to contract. And that pelvic floor is actually under the influence of hormones in a very, very big way. And we don't oftentimes think about that. So we think about the hormonal influence of what's going on with the pelvic floor. You know, estrogen is a hormone that I talked about that goes up, up, and up during pregnancy, and it really helps that pelvic floor expand. It creates elasticity, which means it can stretch and go back into position. It helps with the production of collagen, which is really key for repairing that pelvic floor as things accommodate this journey of childbirth. And so the influence of estrogen is really, really profound. But what happens after that baby is born? Oftentimes after childbirth, we go into breastfeeding, which I think is incredibly phenomenal. But these hormones can diminish greatly, right? Estrogen kind of goes away. Ovaries are not yet re-engaging in ovulation because we're still supporting the life of that baby through breastfeeding. And so sometimes the consequence of that is relaxation in that pelvic floor, sometimes changes in bladder function, like coughing and sneezing will create leakage. We call that stress urinary incontinence. Sometimes urge incontinence, just not being able to get to the bathroom on time. So just know these changes can be transitory. Sometimes there is nothing to worry about. They're only going to last a few weeks and things go right back into position like they should be. But also know if you had those challenges before pregnancy and you just didn't have the language or know about the support that you could get to adjust for those things, or if those challenges continue beyond a few weeks, say 6, 8, 10 weeks, 12 weeks after pregnancy, then know there are many, many things that can be done about that. So one of the things is really working on pelvic floor relaxation and support. And so something like deep breathing exercises, really helping that pelvic floor expand and contract. Kegel exercises, which most people are very, very familiar with, but oftentimes don't know how to do properly. And we talk about that extensively during the podcast. But that's where we're using our pelvic floor muscles to stop the stream of urine. If you can do that successfully, that is a good sign that you have control of those pelvic floor muscles and that you can do that exercise adequately to help restore the pelvic floor tone. But if you're not able to do that, or if these symptoms proceed, just know that pelvic floor physical therapy is something that you should not be shy about asking for. We have plenty of pelvic floor physical therapists in our area and nationwide. So regardless of where you are, typically there's a pelvic floor physical therapist in your area that can help you get connected with what's going on inside your body and really take agency over kind of how you restore normal pelvic floor function. I'll also say if you're having vaginal dryness or if you're having painful intercourse, that's another conversation to be had. Sometimes temporarily using lubricants like hyaluronic acid or even things like silicone-based lubricants can be a really good way to buffer that, because the last thing we want you to do is to get caught in a cycle of pain. Sometimes if there is a cycle of pain, then there's a lot of things that we do to protect that pelvic floor, like positioning of the pelvic floor, that may cause that pain to persist. So I would encourage you to kind of reach out in that area. We also do have some procedures that are very specific to pelvic floor rehab. And so we have procedures that can help restore blood flow. We call that FNP-wave. We have procedures that can restore collagen production. We call that Votiva. And then we have procedures that we use PRP or platelet-rich plasma to do something called an O-shot that we really want to restore that vaginal tissue. So just know there are many, many things that we can do in that area. The other thing that I wanted to get into was nutrition during pregnancy, but also postpartum. And I'll say that I love to think about nutrition in a very individualized, personalized way. So the things that we're going to talk about today are just broad stroke, easy to implement for anyone going through this. But we understand that each person comes into pregnancy with different needs. If you've worked a lot on your pre-pregnant state, then maybe there's less work to do during pregnancy to keep yourself fortified. If you've been behind nutritionally, then sometimes we have to ramp things up during pregnancy to accommodate you. And again, I think the conversation oftentimes goes straight to the baby. What does the baby need? And I think that's extremely important. But we also want to think about, what do you need? What does your body need in order to function properly, not just during pregnancy, but listen, this is an endurance sport. This is for the long haul. This goes beyond pregnancy and childbirth, but child raising too. So keeping your energy good, keeping your vitality strong, and keeping those hormones balanced is really, really important. So when I think about nutrition, I think about omega-3s for your brain health. We oftentimes think about it for the baby's brain health. And yes, it is very important for their brain development, but it's also important for your brain. Your brain actually grows during pregnancy. Sometimes our brains can become really hypervigilant during pregnancy because we have another human to think about. So we need those fatty acids. We need to be including things in our diet like fatty fish to help support that. Walnuts, chia seed, flaxseed. Those can also be ways if you're really not into getting fatty fish in the diet. Those can be really good ways to supplement. And also taking an omega-3 that includes some DHA as nutritional support during pregnancy, I think is essential. I just don't think that we can get enough in our diet to fully support not just the baby, but also you as you go through this life phase. Prenatal vitamins are also important. And I don't think there's a one size fits all when it comes to prenatal vitamins. We have to take things into account, like how much folate do you need? How much choline do you need to support you and the baby? And so there's a lot of different formulas out there, a lot of really good formulas out there. And we also have to think about what can you tolerate, right? Sometimes, especially in that early pregnancy, you may not be able to tolerate much in the way of a prenatal vitamin. So we want to really get in tune with what your body needs. Again, we may start off on one thing first trimester and ramp it up throughout the pregnancy. So just understand that your needs are important and be talking to your healthcare providers about what your body is telling you and what your body needs. The other thing that oftentimes gets overlooked and we talk about in the preconception content is the gut microbiome. The gut microbiome is really, really important for your brain health, for your overall health, but also for the baby. And so consuming some fermented foods during pregnancy, I think can be really important in order to help create some diversity in your gut microbiome. So we used to think that babies got their gut microbiome established after birth. We know that some of that happens in utero now. And so really supporting a normal, healthy gut microbiome through pregnancy is really, really important. Hydration is extremely important for pregnancy development. I think we see when you stay hydrated, especially with electrolytes, we see less headaches, we see less fatigue, we see less achiness during pregnancy, we see better bowel function during pregnancy, less UTIs, less preterm labor, all of the things related to hydration. So I can't state hydration enough. We'll talk in a little bit about environmental challenges with things that we get exposed to. And so I'll say here that really investing in a filter, whether that's just a filter that sits on your counter or a refrigerator filter that you change out, whatever you can do to improve water quality and prevent the use of water bottles excessively. I think we all have to use water bottles occasionally, but we do want to minimize the exposure that we get with water bottles, especially during pregnancy. But including water, of course, coconut water, hydrating fruits like watermelon and cucumber can be a really good way of keeping your hydration status up during pregnancy. Our blood volume increases dramatically during pregnancy, so we need a lot of water to support that. And then one tool that we talk about a lot during menstruation is seed cycling. This is harder to do postpartumly because obviously we may not be having a cycle, but I do believe in getting these seeds in the diet in general. So I did want to mention that. If you are cycling, then you can cycle these according to your menstrual cycle using pumpkin seed and flax seed in the first half of the cycle in that follicular phase, and using sunflower seeds and sesame seeds during the luteal phase. But if you're not having a cycle, just work these into your diet. You can throw them on top of a salad. You can throw them on top of a soup. You can put them in a smoothie. They're kind of easy to get into the diet and pack a really big nutritional punch for fiber, fats, and hormone balance. So I alluded to hormone disruptors earlier, right? I mentioned that as we go through hormonal changes, there are things that influence how our hormones are used. And I want to go into a little bit more detail here because pregnancy is not an exception to this. We often think during pregnancy we don't have control of our hormones because the placenta kind of has our hormones really ramped up, and that's true to some extent. We don't have control over production so much, but we have a lot of control over hormone disruptors. So when I think about hormone balance, I think about production. And during pregnancy, that production is primarily coming from your placenta, right? Then I think about processing, how our body processes those hormones through our liver and then excreting them through our gut. And processing is a really big issue. So anything that we can do to support our liver's health during pregnancy, I think is profound. And then there's proteomics. How does that hormone get intracellular and produce an effect on our body? And this proteomic aspect of hormone balance gets disrupted a lot through environmental influence. So I would say sugar is our primary endocrine disruptor, not only because it dysregulates blood sugar. And as we know, pregnancy is a time where blood sugar dysregulation can become a big problem. We screen for that during pregnancy for pregnancy induced diabetes, right? Gestational diabetes. And so sugar is one of the main inflammagens that can happen and that we can control for. Um, Things like dairy and gluten can be inflammatory, especially if you're reactive to those things. And so just making sure if you know already that you're reactive to those things, I would resist the urge to add them back during pregnancy. We know environmental toxins, if you live in an industrial area, think about Mississippi, our Delta has a lot of industrial pollutants related to farming and the farming industry in that area of our state. I think about caffeine. We're told during pregnancy to reduce caffeine. Of course, we're not doing alcohol during pregnancy typically. Stress can have an impact, and then lack of movement. So, whatever you were doing prior to pregnancy, whatever your fitness level was prior to pregnancy, typically we're going to say that's okay to continue. Again, with relaxin on board, I would say let's tone down the high intensity workouts. We really don't need to be doing that. We don't need to be heating the body that much during pregnancy, and we don't need to risk injury. And so, if you've been running, I would say walking, maybe some fast walking would be okay. Light jogging if you just really have to do it, but keep it relatively low intensity. I love things like yoga and Pilates during pregnancy because they really encourage deep breathing and that pelvic floor expansion that we talk about. All of those things really do help balance your hormones. Do not take those for granted. And then from a dietary perspective, looking at the Environmental Working Group has a list of dirty dozen foods that we want to make sure if we're consuming those foods that we're getting those organically as much as possible. And then there's a clean 15. So we don't have to do everything organically. There is a clean 15 list. So those things are you can do conventionally, but you want to make sure you are washing them properly to remove anything that they got on them during transit or through cross contamination. And so just making sure that we understand our dirty dozen and our clean 15, and we're choosing as wisely as possible. I wanted to highlight where we may find some environmental toxins. I mentioned water bottles at BPA. You know, a lot of times you'll see water bottles that are labeled BPA free. They have other BPs in them. Those have not been studied as much. And so I would say, again, just minimizing water bottles as much as possible. Think about things you're putting on your skin, our makeup, our skincare. You know, those can contain things that affect you, but also can transcend into that placenta. Things like heavy metals, mercury. So just minimizing as much as you can. We don't want to invest in any type of detox during pregnancy. Your body's working hard enough. We don't want to mobilize anything that is stored in the body during pregnancy. And so just really working on the foundation of what good nutrition can look like, making sure that we're making the best choice possible, again, for yourself as well as the baby. I oftentimes get the question, like, how do I test my hormones? Typically during pregnancy, we're not testing hormones so much. We know hormones are typically elevated. Sometimes early pregnancy, we are measuring HCG and we are measuring progesterone, especially if there's been a pregnancy loss in the past. And I would say those are perfectly fine to measure through blood testing. No need for fancy testing for those. We typically see what we need to see in blood testing. But beyond pregnancy, in that postpartum phase, if you're really wanting to see what's going on with hormones, I am a big fan of testing adrenal hormones during that phase. I think really seeing what's going on with our sleep cycles, what's going on with our stress response can help make some really good decisions about how we're setting up our postpartum lifestyle because sometimes we can't control everything. That baby's going to keep us up at night. But if we had a little bit more help or a little bit more understanding of what's going on internally, sometimes that can help us recruit. Sometimes we're afraid to ask for help. We think it's all on us to take care of business. But the truth is you need to sleep too. And sometimes that lack of sleep and that hypervigilance that I mentioned earlier that can happen with the brain, sometimes we need better tools to help settle that. And sometimes you just need to see it on paper. So salivary testing for that purpose can be really impactful. And then I do recommend, 6 months out, depending on how long you're planning to breastfeed, And depending on how you're feeling, if you're feeling great, then there's really no need to test at that point. But if you're feeling like, hey, things could be better, then I would say 6 months out, let's be looking at these hormones through more comprehensive testing where we look at urinary levels as well as salivary levels. And we can do that through Dutch. We can do just urinary, we can do urinary and salivary, whatever the provider thinks is most important, most impactful for you at that time, depending on what we're trying to solve for. I just like you to understand the different ways of testing so that you know kind of what you're investing in and what you're going to get out of that testing. The Dutch test is just more comprehensive because we can see not only the hormones being produced, but how you're metabolizing them, and then key nutrients that help us keep those hormones balanced. And postpartumly, I think that's really a struggle for some females is to catch up nutritionally, especially if they've had back-to-back pregnancies. So when we think about removing things that can impair hormone balance, I just wanted to give you a few little tips. Oftentimes we don't think about the little things, and oftentimes it's the little things that can make the most impact. And there's so much that we can be doing, but what should we be doing? So I think about cleaning products. There's simple things that we can be doing in the way of changing out our cleaning products, like using baking soda and vinegar, hydrogen peroxide and water. I mean, those are simple things that we can be using for cleaning. So again, that we're not being exposed to all the harmful chemicals that oftentimes get packed into those and we breathe them in as we're cleaning up and nesting, especially that third trimester. I mentioned, how do we keep our hormones happy? It's way beyond hormone production. And that's what I want you to hear. Simple things like getting outside, moving your body, taking some time to enjoy your meals and having really nutritious food during your meals. Oftentimes with pregnancy comes cravings, and oftentimes those cravings are a result of just not getting the right nutrients at the right time. So slowing down your meal time, really enjoying that food, and connecting with what you're eating. Sometimes that's enough to correct for those cravings. Those cravings typically are telling you something. So sugar cravings oftentimes are telling you your body needs more magnesium. So doing some Epsom salt baths for relaxation, sometimes even taking extra magnesium if you feel like you need that, and discuss that, of course, with your healthcare provider. But that can be a really good way of keeping things calm and relaxed during pregnancy, helping with sleep, helping with bowel motility. That nutrient oftentimes is depleted in women of childbearing years. Getting adequate sleep. I mentioned changes during pregnancy. Sometimes that third trimester can be a challenge. And oftentimes I think it's God's way of preparing us for those sleepless nights with the baby. But sometimes getting comfortable at night can be a challenge. Getting cool enough, getting positioned in the right position for comfort during pregnancy can be oftentimes elusive. But getting restful sleep is important. And then anything that we can do to balance blood sugar. So I mentioned we get screened during pregnancy for gestational diabetes. Even if you pass that screening, I would encourage you to make sure you're eating in a way that helps you keep blood sugar balanced. You're going to feel so much better. Your energy is going to be more balanced. And what does that look like? That looks like getting some protein with every meal. That looks like not going super long intervals between your meals, making sure that you are hydrated well, and making sure that you're moving your body. I really am a fan of doing like a 10-minute walk after each meal for the purpose of blood sugar stability. Sometimes that can go a long way in just keeping things nice and balanced. So I wish I could say there's a perfect prescription for hormone balance, that I could just give you a pill, right, for this purpose. But truly, there's not a pill. Hormone balance encompasses so much more. We've talked about a lot of it today. So if you could take away a few things from today's talk, I want to say support blood sugar by balancing the timing of your meals, balancing the timing of your movement, reduce incoming exposure of toxins. So we talked about some ways to do that through plastics, personal care items, household cleaning items. We didn't talk much about meat sources, but that's another way of making sure that we're getting meats that are raised in a way that do not contain hormones. That can really be impactful as far as keeping hormones balanced. Managing stress. I mentioned the hypervigilance that can come with pregnancy and childbirth. Recognizing that in yourself. Are we starting to see that we're getting keyed up over things that typically didn't? bother us and really look for tools that help you regulate yourself. Anything from yoga to Pilates to walking to talking to a friend, any of those things can help build resilience in your day to day life. This endeavor of childbirth is an endurance sport, I am convinced, and it should be a team sport. So, building your support system around you, I think, is also really, really important. And then if we could do one thing before pregnancy and even during pregnancy, it would be addressing any underlying challenge that we're having with inflammation, body composition challenges, making sure the thyroid is balanced, controlling for sleep apnea if that's a challenge. We're seeing that more and more today. All of those things go into a perfect prescription for helping you regulate hormones during pregnancy and beyond. So I would empower you to take control of your health. At Enhanced Wellness Living, we believe that your hormonal journey is a journey. And with each phase of life that you're in, regardless of the struggle that you're having, or maybe you're not having a struggle, maybe you just want to understand your body better, we would encourage you to partner with someone that has the same mindset that you have in the way that you want to manage your lifestyle and your body. We have a few ways that you can connect with us: Facebook, Instagram, and of course, our website is just filled with lots of tools, resources, information, recipes. You could spend a lot of time on the website and make a lot of progress just with your personal self care. During this time of the Women's Health Summit, we are offering some pretty amazing benefits. I mentioned some procedures that we offer for female sexual function and urinary function. We're offering some discounts on those. We are offering some discounts exclusively to you on pricing for hormone testing as well. If you're wanting that information, please reach out to Chelsea. And Chelsea, I'll let you give them that number so that we make sure that they have what they need in order to reach out properly. And again, we just appreciate your time. We value your help. We value you as a person. And we just want to make sure that we're giving back in a way that makes sense and that's empowering you to take the next steps.
Yeah, thank you, Kelly, and thank you guys for watching, for joining us. Like Kelly mentioned, we want to help you navigate through the next steps. So give me a call directly. My number is 601-724-7882. It's 601-724-7882. We'll make sure that's also posted below in the video notes. So check that out. We'll have Kelly's podcast, a couple other resources for you. And please do share this information with all the women you know and love. We are here to help. Thank you all.